Salutations, this is Brian Jarris from Ville Wealth Management. In today's video, we're going to discuss planning for Medicare by age 62. Ville Wealth videos are meant to be educational only, so if you need customized advice tailored for your situation, please reach out to us at villewealth.com. According to a Fidelity retiree healthcare cost estimate, an average retired couple age 65 in 2024 should expect to spend around $330,000 in healthcare expenses throughout their retirement. So let's take a look at the different parts of Medicare. So we've got Part A, which is typically premium free as long as you meet the 10 years of work history. It covers your hospital visits, hospital stays. There is deductibles and co-insurance, and once you get past a certain number of days, then you're starting to pay out of pocket, so it can get expensive. Part B is voluntary. The current cost for a premium, monthly premium in 2025 is $185, but that cost can increase based on your income due to the IRMAA surcharge. It covers your doctor visits, outpatient services, and it covers 80% of your expenses where you have to pay 20% out of pocket. So what most people do to cover that gap is they either get Medigap insurance or they take a look at Part C, which is Medicare Advantage. Lastly, there's Part D, which is prescription drug. Now, some good news here. In 2025, they've now put a cap on your out-of-pocket cost for covered drugs at $2,000. So no longer are you faced with what they call the donut hole expense. So when should I begin planning for Medicare? I'd recommend you start thinking about it and planning in your early 60s. Start forecasting what are your healthcare costs going to look like in retirement. The best way to do that is to do a retirement analysis or a financial plan. Also be aware that your Medicare Part B and D premiums are calculated on your income, your adjusted gross income from 2 years prior. So for example, at age 65, it's going to use your income from age 63. So you might be saying, well, wait a minute, that's not right because I was still working at a high income. Am I now going to face those IRMAA surcharges at 65? The answer is you very well could, but don't worry, there is an appeal process. You can file Form SSA-44, and retirement is a valid reason on the form to justify not using the estimate from 2 years ago, but using current amounts. Now, be aware that if you do real estate sales, Roth conversions, transactions like that, that wouldn't qualify, and you still would have to use those estimates. Let's go over the initial enrollment period. It's a 7-month window beginning in the month of your birthday, and it includes the 3 months prior to your birthday month and the 3 months after your birthday month. Now, if you apply for Medicare benefits during those first 3 months, your Medicare will start the first day of the month of your birthday month. If you file during your birthday month, it'll begin 1 month later. And if you file in those last 3 months, it'll begin 2 months later. So it's really important that you time when your employer healthcare benefits stop and when the Medicare benefits begin. You don't want that lack of coverage. Now, there's also 2 things I want you to be aware of with HSA accounts. Once you enroll in Medicare, you can no longer contribute to your HSA account. If that wasn't bad enough, within 6 months of beginning benefits, you'll get penalties if you contribute to your HSA account. So here's an example. If you are going to start Medicare in July of next year, you're going to want to stop your HSA contributions at the end of this year. Also, if you do not sign up for Medicare A and B during this 7-month window and you miss it, you have to wait to another enrollment period in order to do that. Let's talk about those other enrollment periods now. There are 4 main enrollment periods. Let's go over each one. So there's the initial enrollment period, which we just talked about. The second one is the annual enrollment period, which is October 15th through December 7th. And this is when you can change your Medicare Advantage or your prescription drug coverage plans. Then there is the general enrollment period, which is January 1st to March 31st. And if you miss that initial open window, then you can apply for your Medicare Parts A and B in this window. Then lastly, there's the special enrollment period, which applies under 3 circumstances. 1, you're with an employer that has more than 20 employees. 2, you were covered under your spouse's plan. Or 3, you had a life event, such as getting married, you were moving, or you lost your health care coverage. So for our last topic, let's go over 2025 Medicare facts and figures, starting with Part A. So Part A is premium free. It has a deductible of $1,676. The amount that you pay is based on the number of hospital days. Part B, there is a premium of $185, which can increase based on your modified adjusted gross income. Remember, it's based on 2 years prior. It can go up all the way to $628 a month. There is a $257 deductible. When we compare Medigap to Medicare Advantage, Medigap has higher premiums, but its coverage nationwide versus local with Medicare Advantage. There are no referrals necessary for Medigap where they are for Medicare Advantage. There could be medical underwriting for Medigap if you're outside that window, and there usually is not for Medicare Advantage. Prescription drugs are a separate plan for Medigap, may be included with Medicare Advantage. Your out-of-pocket maximums are limited with Medigap, but could be up to $9,350 for Medicare Advantage. Taking a look at Part D, the average premium nationwide is around $46.50, and there could be a surcharge added to that up to $85.80 based on your modified adjusted gross income. When we look at the different Medigap plans from A through N, I would tell you the most popular plan, what they call kind of that Cadillac plan, is Plan G. So to summarize, there's a lot of decisions to be thinking about. Start thinking about these Medicare decisions in your early 60s. Do that healthcare forecast of your expenses with a retirement analysis or financial plan. Definitely recommend you meet with a financial advisor. And when the time's ready for you to make these options, they can help refer you to a Medicare professional. So I want to thank you for watching today's video. This is Brian Jarris from Vil Wealth Management. And if you want to get a hold of us, you can reach us at vilwealth.com. Thank you and have a great week.